Hello everyone, it is Dr. Nurse Tutor and I am back with another video. My video that I have today for you guys is going to kind of piggyback off of the last video that I had that was pertaining to students being unsuccessful on their exams due to lack of prioritization. This video is going to be a little bit different as to what I am noticing and seeing in students who are unsuccessful on their exams. Another reason that I am seeing why students are unsuccessful on their exams is because they are not understanding nursing language. I don't mean medical terminology. I more so mean the language that nurses speak to each other in order to understand what is going on with the patient and what actions need to take place. For instance, when you're taking an exam, you're going to give 3 kinds of popular questions that want to know that you know what you're supposed to do in order to provide interventions to your patient. One style of a question is going to ask you what your nursing interventions are pertaining to your priority nursing interventions. What is the first thing that you are going to do? What is the action plan, the immediate action plan? All of those kind of questions are going to want to know what your nursing intervention is, but what your priority nursing intervention is, meaning what are you going to do first? The next kind of question is going to be a select all that applies. I know we hate select all that applies, but literally the only thing that select all that apply means is what are all of the interventions that you are going to do to make sure that this patient is okay, right? And the last kind of question, or the third most popular question that you're going to see, is what do you anticipate is going to happen? Anticipate means that with everything that you have done, it has not been successful in helping this patient's condition, so it is now beyond you. Anticipation means to wait for direction. So now with all the interventions that you have done, they haven't been successful, the patient is worsening. What do you think the doctor, the PA, or the nurse practitioner is going to order? What are the following steps going to be in order to save this patient's life? For instance, I'll give you an example. You walk into the room of your patient and you go and ask your patient how they're doing. And you walk into the room and the patient tries to respond to you, but the right side of your patient's face is drooping and the patient has slurred speech. Right? In your mind, you should be thinking, okay, this patient is probably having a stroke. I don't have time to think. I am going to activate a cold stroke. That would be your priority nursing intervention. You walk into the room and you see your patient has slurred speech. You see that your patient is not communicating with you, and you have already assessed this patient prior to during your shift, and this patient was okay. You are going to activate a cold stroke if this patient has slurred speech and this person's right side of the face is drooping. If it was a select all that apply, I want you to continue with your assessment until help arrives. They should be there in about 30 seconds, right? I want you to go ahead and do a neurovascular check on your patient. I want you to check your patient's pupils. I want you to assess your patient's pulses, check for paresthesia, check for numbness and tingling, check for paralysis, check for pallor, check for pain, because while you're doing that, help is on the way. If you can, check vital signs, listen to your patient's heart and lung sounds, check those pulses, right? A part of your neurological assessment, because when you're done doing that, the stroke team is already going to be there and in action. Even if you're wrong, I would rather them talk about you, right, than you not activate that cold stroke and delay treatment for that patient, because we know that time is brain, right? The next kind of a question that you're going to get is, what do you anticipate is going to happen? Anticipation means it is now beyond you. It is out of your control. All the interventions that you tried to do are not helping and your patient is declining. Now we need the direction of the provider. What do you anticipate the provider is going to do? I would anticipate that the provider is going to have that patient rush down to get a CT scan or an MRI to now see if this is an ischemic stroke or a hemorrhagic stroke. We need to know what kind of stroke this is, because that's how we're going to determine what treatment the patient is going to need, whether it be TPA or the patient go down for surgery if it is a hemorrhagic stroke. Okay, so those are the kind of questions that I mainly see, and you will mainly see on your exams and even your NCLEX. I need to know, right, And even if it is a select all that applies, I want you to get into the habit of choosing all the interventions that need to happen with your patient, but I want you to choose them in chronological order, from priority, most important, down to the least important. Even if the question's not asking you that in the select all that applies, I want you to get into the habit of answering the questions like that in chronological order, from most important to least important. Does the question want to know what my priority intervention is? What is the first thing that I'm going to do of all of my interventions? Does it want to know all of the interventions that I'm going to do, but I know that I'm going to do it in chronological order from most important to least important? Or does it want to know what I anticipate is going to happen moving forward? Okay, I do hope that that did help. Please get into the habit of answering your questions that way by understanding what language is being spoken to you, what is being asked of you. Because if the question is asking you to anticipate and you still working on the patient, you're not going to be able to follow the direction of the doctor. All right, so understand what the question is asking you so that you can better figure out or determine what your next plan of action is going to be to save your patient's life. All right, so this has been Dr. Nurse Tutor. I hope that this did help. Stay tuned for more videos, and I will be back with more ways to improve your test taking skills. Bye for now.